So this is Dr. Michael Ryan talking about a topic that most people are very fearful of, but really don't know very much about, which is the development of a skin sore or skin ulcer related to a vein condition. An ulcer is a breakdown of the lining of a tissue. So you can have an ulcer in your stomach, but also in this case, you can have an ulcer of the skin. So they're called interchangeably skin sores or skin ulcers. And the situation with the vein circulation is that the vein circulation in people that develop a skin sore is not functioning properly. The blood is stagnant, and the stagnant blood triggers an inflammation reaction and a buildup of inflammation. And the inflammation becomes so abundant and excessive that it prevents the normal functioning of the skin, and the skin begins to spontaneously break down. This is one of the hallmarks of a vein, a venous ulcer, as we call it, which is the spontaneous development of the ulcer. The other hallmark is that before it develops, there's usually a period of months to years where there is a clear abnormality of the skin color. It's brown, it's red, it's angry, and that is in the same area where the ulcer develops. So, and what that represents is that the inflammation is building up in the tissues and the body is reacting to it. The skin also tends to become very tough and hard. And what that is the reaction of the skin to all the inflammation. And basically the skin is forming scar tissue under the surface and becomes very hard. And so after this period of skin discoloration, the skin sore develops, and then the skin sore tends to come and go. It can heal, but then breaks back down again. The first thing I recommend that people do is to put compression stockings on, because that will help the skin sore heal, and it does that by reducing the amount of inflammation in the tissues. The best way to prevent a skin sore from coming back is to have a vein treatment. Obviously, a full evaluation with an ultrasound would be needed, but that is the best way to prevent the skin sore from coming back, because as soon as you stop using compression stockings, 90% of people will get the skin sore coming right back. So the good news is that it's easy to sort out what is causing the problem with an ultrasound, where we can look at the veins under the surface, and the treatments now are very easy to go through and very effective at helping the sores heal up and then not come back. So Dr. Mike Ryan discussing skin sores and skin ulcers and vein circulation.